questions coming through my website, and we go through them with Barbara. And I think we have 3 today, so off you go.
Okay, our first question is from Michelle. She's 50 years old. Her concern is under eye hollows. What are some alternative treatments to use under eyes? These are a lot of questions where women don't want to have surgery or plastic surgery, but they're looking for options.
So under eye hollows here, let's be clear, if it's hollowness where you've lost volume, then a filler treatment is appropriate. Typically, it's an advanced therapy done by a skilled practitioner using the right filler at the right depth and usually not using very much. There are different techniques using needles or cannulas. Other options might include new things that are coming onto the market, such as exosomes or polynucleotides, I should say, really. And there are other treatments that may help to tighten the skin, but they're not necessarily going to treat the hollowness. You really do have to put some filler or volume down there, but not too much and at the right depth. Otherwise, you'll end up with puffiness that can be going on for years. You can have a lot of drainage issues, so you have to find the right person. Not everyone is suitable just because they've got a hollow. I'm not, for example. So if I had treatment here, it would probably make things worse in the long term. So again, a very careful assessment by a skilled practitioner.
Okay. Narmeen wants to know that she had nasolabial filler. Is it going to dissolve on her own in 12 to 18 months? Is that true? How long does it last? Does it dissolve on its own?
Well, the fillers that we use are hyaluronic acid. They are cross-linked, and they mimic very much the hyaluronic acid that we already have in our skin, in our tissues. They typically vary in terms of how long they will last. That depends on where they've been placed and how much has been used. If you have a light filler, they will last maybe 6 months, possibly longer. If you have some of the thicker fillers, the volume type fillers, they can last anything from 12, 18 months, 2 years, and sometimes longer. Generally speaking, I mean, nasolabial filler, we try not to put too much in this area because that's not really treating the cause, that's treating the consequence. And if you do that, you can end up with a chipmunk look. It's not the way to treat by just putting filler into this area. And if you do put stuff in there, it can last longer, because if you put too much and it's the wrong depth, again, it will last longer. And I touched on it briefly in the last question, particularly around the tear trough area. My colleagues, the oculoplastic surgeons, are finding the filler there that's been there for 10 years, and I'm coming across this too. That's usually where the wrong filler being placed at the wrong depth. So they can last a long time. They do naturally dissolve, and that's variable.
Oh, good advice. Lily wants to know what the safest way to lift the corners of the mouth. We get a lot of questions on the corners of the mouth. Could you give her any advice? What's the safest way?
The corners of the mouth, it again comes down to a careful assessment. So one of the easiest things to do if you have good muscular tension in this muscle here that pulls down the corners of the mouth is to actually give a Botox injection in here, which will relax it and lift the corner of the mouth. But as we get older, that muscle becomes weaker. And again, if you're not a skilled practitioner and you miss that muscle, usually by a couple of millimeters, you can actually make the corner of the mouth droop even more. So you have to know your anatomy. Another way of treating, lifting the corner of the mouth is, because this muscle is pulling things down, you can use a myomodulation technique using a very fine filler which you place on top of the muscle, and that prevents the muscle from pulling down. It inhibits the action of the muscle pulling it down. The other thing you can do is to also use filler here to strengthen the corner of the mouth. And again, we're using much finer fillers around this mouth area, the parietal region. We don't want to use thick fillers. You're going to look weird if you do.
Well, what are you saying? You're saying there are a lot of options out there, but you have to go to the proper doctor who will assess your problem and decide what filler and placement.
Absolutely. Again, there'll be a number of variable factors. Age will come into it. You know, do you have what's actually causing that downturning of the mouth? Is it an aging aspect? Is it a hyperactive muscle? And then you have these different solutions, options that you can use. So yeah, a skilled practitioner, again, is what you should be seeking to deal with this.
Perfect advice. That's it.
That's it. Thank you. If you do have any more questions, please go to my website and submit them through my email there. Thank you.